We know some of you are concerned about the coronavirus and what's being done about it. So we asked you to send in your questions for a medical expert. I'm joined now in studio by Deputy Chief Medical Officer of the Department of Health, Dr. Ronan Glynn. Dr. Ronan Glynn, thank you very much for coming in to answer the News Today viewers' questions. So our first question is from second class in Hansfield Educate Together National School, and they want to know:
how did COVID-19 start?
So how did it start, Ronan?
Sure, Aisling. So this is a new virus, and we've only known about the virus for about 2 months now. It started in China. We think, like with lots of new viruses, it came from an animal and it transferred into humans, and now it's spreading from person to person. We're not quite sure yet what the original animal it came from was, but scientists are still looking into that and trying to figure that out.
Ryan O'Connell from Navan asks, is COVID-19 coronavirus as bad as everyone is saying it is?
So there's an awful lot of talk about coronavirus at the moment. It's all over Twitter and it's all over social media and in the newspapers and on television. And when that happens, people can get very worried that something very bad is happening. This is a new virus and we're learning lots about it every single day. Of course, with any virus, it will make some people sick. But what we know already about this virus is that the vast majority of people who do get sick with this will not get very sick at all. They won't need to go to hospital. They'll be able to continue on. They'll be at home for a few days while they recover, and then they'll just get back on with their lives as normal.
Sophie O'Malley in Sculcatrina in Ballyshannon, County Donegal has sent in her question for you.
Will schools and transport services have to close down because of the coronavirus?
So will schools or public transport systems have to close down?
So at the moment we're not planning that any of that will need to happen, but as people will see on the news and again in the newspapers and everything, there's more and more cases of this every day. So we're watching that really closely, and we work with people across Europe to understand how this is changing. And as I said, each day we look at it, and if we need to make decisions like that, we will, but we're not at that point yet.
Emma and Jane Donnelly from Edenderry ask, can children get the coronavirus and what are the symptoms? So
anybody can get the coronavirus, but we know from what we've seen in China over the past few weeks that in fact children are it really doesn't affect children at all compared to the way it affects older people. And for the vast majority of children who do get it, it'll be a very mild illness. And again, they won't need to go to hospital. They'll be able to be managed at home. They'll recover and they'll get on with their normal lives. I think it's very important, though, that we all know what symptoms we need to look out for. So the coronavirus causes symptoms that are very similar to what you get with a cold or a flu. So you might start coughing, you might start sneezing, you might have a temperature. And if you have those symptoms, the first thing you should do is talk to your mum or dad, tell them that you have them, and they'll know what to do, and they'll get you to talk to your doctor if you need to.
Some of our viewers also want to know, if you get it, how long will you be sick, and is there any medicine, cure or vaccine?
So again, what we know about it so far would suggest that if you do get it, you might feel unwell for up to 2 weeks, and then you'll recover. There isn't a vaccine at the moment, but scientists are working really hard on that. They're working day and night on that. There's probably more work going on to find a vaccine for this virus than there has ever been before in human history. All of science and all of medicine is coming to focus on this. And we've seen developments already over the past number of weeks at a speed that we've never seen before. So we're confident that there will be a vaccine. We're confident that there will be treatments. I can't say when we'll have them, but hopefully they'll come sooner rather than later.
And now a question from Danny Goff in Ballycanoe National School in Gorey, County Wexford.
My name is Danny Goff. I'm in 6th class in Ballycanoe National School, and my question is, do you have to wear a mask, and if you do, does it work?
So Ronan, do you have to wear a mask, and if you do, does it work?
So it's very important that people don't wear masks unless they have to, because we need to keep the masks for all of our doctors and our nurses who work in the hospitals. They're the ones who really need the masks. If you have masks at home, And if you're coughing or sneezing, well, then it's not a bad idea to wear one, because it means that you won't cough or sneeze onto somebody else and make them sick. But wearing a mask really won't protect you. The main thing you can do, the main thing we can all do to protect ourselves, is to wash our hands regularly. And that's not just putting your hands under the tap. You need to spend 20 seconds with so get some soap, make sure you've got bubbles in your hands, and then spend 20 seconds under warm water. Make sure you get in between your fingers, make sure you get the top of your fingers, and then dry, ideally with a paper towel, or if you're using a normal towel, make sure it's a clean towel. The other thing everybody should be doing now is carrying a pack of tissues with them. So if you do cough or sneeze, you cough or sneeze into the tissue, you then bin it and immediately wash your hands again. And of course, if you don't have a tissue and you have to cough or sneeze, if at all possible, you should be trying to do it into your elbow.
Second and third class in Skullbreed, Loretto, Killarney, County Kerry want to know, do you think the St Patrick's Day parades will go ahead across the country?
So at the moment, the St Patrick's Day parades are going ahead all across the country, and we certainly hope that they'll go ahead. The last thing we want to see is those parades being cancelled. We know it's important, we know everybody loves them, but we are keeping the situation under review. Things are changing really quickly every day. There's lots and lots of new cases in Italy and across lots of countries in Europe. So we need to think about the health of everybody in the first place. And so yes, at the moment, everything is going ahead. But as I said, we need to keep looking at it every day. And if we need to take some other measures, like cancelling some events, then we will. But that's not our plan at the moment.
Fifth class students from Sculls and Trassa want to know, how much hand sanitizer should you use in a day and when should you use it? Is it possible to contract the virus twice? And is this the worst case of a virus recorded?
So in relation to the hand sanitizer bit, if you have access to soap and water, it's better to wash your hands regularly with soap and water. If you don't have that, though, of course, hand sanitizer works as well. You should wash your hands or use hand sanitizer after you go to the toilet, after you feed your pets, if you're preparing food, before you prepare the food. If you've been out and about and you come back into your house, you should wash your hands. If you've basically been in groups of people and come back in, you should wash your hands or use hand sanitizer. Is this the worst virus we've ever had? No, it's too early to say that. And again, this virus, so you'll see that there's lots and lots and lots of cases of this virus. But the vast majority, most people who get it, get a very mild illness. So yes, lots of people might get this virus over the coming weeks and months. But most people, and particularly we know from what's happened in China, that nearly all children who get this virus, it'll be just a mild illness, like a cold, and then they'll get better.
And is it possible to contract this virus twice?
So we're not sure yet. So there's lots of things we still don't know about the virus, and that's one of them. So usually when you get, not usually, sometimes when you get a disease like this, it means that you're immune and you can't get it again. We're not quite clear about that with this virus so far.
Billy Beasley in 6th class Ranelagh Multi-Denominational School has sent in this question in a video.
My first question is, up to how many people could one infected person infect? And my second question is, what impact could the coronavirus have on Ireland?
So up to how many people would one infected person infect, and what's the potential of this epidemic in Ireland?
Okay, so when we look at how many people a person infects, we use a scientific measure, and it's called the R0 value. And basically what that is it gives an idea of, if I'm infected with it, how many people is it likely that I'll infect? And so at the moment we estimate that that's about 2.2 for coronavirus. So for everybody who gets coronavirus, we think they may infect 2 other people. But of course that depends on all of the measures that we're taking within the health service to control this and to contain it. So we would hope in fact that it will be much less than that and that we can stop this spreading.
Savannah McCormack from Scoil Katrina in Ballyshannon, County Doll wants to ask her question.
Can pets get the coronavirus?
So can pets get the coronavirus?
No, there's no evidence that pets can give it to us or that we can give it to pets. But it is very important, again, for a variety of reasons, that if you're feeding your pet, if you're playing with your pet, that you wash your hands afterwards, and particularly before you eat food or before you touch your nose or your mouth or your eyes.
Second class in Hansfield Educate Together National School have sent in 2 more questions for you.
Can food be contaminated? Will COVID-19 go away?
So we had, can food be contaminated, and will COVID-19 eventually go away?
So food can be contaminated with lots of different things. We know that there's no risk from food that's come from China because it takes so long to get here. But with any virus, it is, you know, if someone sneezes onto food and then you touch that and then you touch your mouth or your nose, of course, you can give yourself the illness. So again, what I would say to people is, before your mum or your dad, or before you prepare food or eat food, again, just make sure you wash your hands. And if someone is sick in the house, they really shouldn't be preparing food whilst they're sick.
And will this eventually go away, coronavirus?
We certainly hope it will. We're not sure yet, being honest, how this will develop across the community. But I think it's important for people to understand that we deal with viruses and diseases like this all of the time. This is getting lots of media coverage because it's a new one. But remember that we have the flu every single year in winter time. Our doctors and our nurses know what to do. We've been preparing for this for weeks and weeks now. So I'd really urge people not to worry. Our health service and as I said, our doctors and nurses were ready for this. And we will do what it takes to make sure that we protect our population.
And is there anything else that you want children to know about this coronavirus or about keeping healthy in general?
I think the main message is that there's something that each and every one of us can do. I can do it, my children can do it, everyone across our community can do it, and that's to wash our hands. It's to make sure that we're coughing and sneezing in the right way. It's to make sure that we're following all the advice that I've given around pets and food, and really just to talk to your mum and dad if you've got more concerns. What we don't want people to be unduly worried about this. Your mum and dad will know where to go for more information, and you yourself can go to www.hse.ie, and there's lots and lots of information there if I haven't answered all the questions for people.
Dr. Ronan Glynn, Deputy Chief Medical Officer of the Department of Health, thank you very much for answering the News Today viewers' questions.